Valerie, I am a country doctor, and I see that Medicaid patient that works from can to cane every week, and I want to make the system work. But let me be blunt and let me tell you this. If we don't get this Medicaid expansion under control, it is going to bankrupt this state. That's just the truth. This current administration seems to brag about how many new people are enrolled on the healthcare issues. And over the past 3.5 years, I've seen the numbers grow, but I've seen very little discussion about the growing cost of this program. We've had a study here recently that says Louisiana is #1 in the country for growth in Medicaid spending. Just this year, the current administration revised its Medicaid forecast to show that $400 million in unexpected payments for Medicaid expansion because the program is way more expensive than they initially told us. Some of it has to do with a huge number of people that have been signed up, but a lot of it has to do with no or very little accountability. So, how do we fix it? Look, the decision has already been made. It is law. And we can't put the car in reverse on the interstate and expect it to turn around. And while the decision has been made for the expansion law to take place, we have to have a responsibility to be smart about it. That's something that the current administration has not done. We need to protect the investment that has been made. We have to make sure that we aren't giving taxpayer money away to people who are not eligible for it. We just saw where almost $100 million went to 30,000 recipients that were ineligible, and that just is not acceptable, certainly as me as a physician, because what happens, the people that need that money on Medicaid are being cheated of not being able to get the health care that they need. If I'm your governor, if you're not eligible for Medicaid, you're not going to be on the road. But if you are eligible, we want you there. We're going to take care of you. And when the DHA was asked about wasting almost $100 million, they said it should not surprise anyone. Well, guess what? It surprised me and it shocked me that we had that much. We've got to control our costs. We've got to incentivize my beneficiaries on Medicaid to make good health decisions and utilize health care in the right way. We've got to be smart. They have to have access to other telehealth programs. They've got to have access to other specialists that they do not have access to now. And we've got to go with CMS models of encouraging telemedicine and other models to improve health care. I know how to fix this. Jobs, Jobs. A good job solves a lot of problems with this Medicaid expansion.
Thank you. It's a great question, Valerie. And the fact of the matter is expansion has helped our state in many, many ways. One of which is by simply bringing our federal tax dollars back from Washington instead of having to go to 30 other states. We're bringing them home to provide health insurance for our working poor here in Louisiana. And it is saving us money. It's saved over $300 million in state general fund already because of the enhanced federal match. If someone is uninsured, it costs 40 cents on the dollar when they go to the hospital, but we can insure them for no more than 10 cents on the dollar through the Medicaid expansion. The 40 cents is general fund, where we were short. The 10 cents is a statutory dedication that we wouldn't have but for the fact that we expanded Medicaid. So it's the right thing to do to get health insurance for people, and it actually improves their lives and it saves their lives. You know, more than that, we know that the economic impact is $3.5 billion a year that is spent in every single community in the state of Louisiana. It's responsible for 19,000 jobs. There's your jobs, Congressman. It also is responsible for $100 million in general fund revenue because of that economic impact. Now, the fact of the matter is, the Congressman has voted 7 times to end the Medicaid expansion program. That would be horrible for the state of Louisiana. We have been able to cut the number of uninsured working age adults in half, the lowest it has ever been in the state of Louisiana. And unlike other states across the South that didn't expand Medicaid, we have not had a single rural hospital closed. And you do have to make adjustments over time in your Medicaid program as you see utilization increase or decrease. And that's a very routine thing that happens. And that's what came out in the budget hearing this week. There's been a utilization increase, and we need to be able to pay for that. But we still won't use any general fund to do that. We'll use statutory dedications. So I am proud of the fact that we're insuring people in Louisiana. I am proud of the fact that they have access to health care coverage because we are saving lives. The same Catholic Christian faith that tells me that being pro-life on abortion is right tells me that the Medicaid expansion is a pro-life position too. And I meet people all the time out there who tell me what a profound positive impact Medicaid expansion has had on their lives. And in fact, some of them even tell me they wouldn't be alive today without it. So I'm not going to back up on the Medicaid expansion, and I am committed to making sure that we root out waste, fraud, and abuse. And in fact, I'm the one who ordered the investment in the new system so that in real time we access more federal and state databases, and eligibility changes, by the way. It isn't fraud. If you get a better job, you make more money, you get on the other side of the 138% federal poverty level. That's not fraud. Just eligibility changes.